Okay, so I'm gonna keep it at, I'm gonna change it to 28 to 49, which is reasonable, and it covers a good area because all the research that I found, it looks at middle age as well. And middle
That's
age,
fine.
yeah.
Yeah, that's fine, because then obviously you are saying, because that's where, remember, one of the criteria for doing your research is that you can find the data and you can access the data.
Yes.
So you can justify. That's fine. That's not a problem.
Yeah. But then how would I format now so before I had adult male suicide England. Now I've put an age in. So how would I put it into my assignment? As in, how would I make a sentence?
It's adult aged, okay, causes of suicide among the adults aged, okay, from this to this year. Yeah. So from 20, whatever you call it, 25, is it 20 what?
28 to 49.
Yeah. So 28 to 49 year old in England. That's all.
Okay. Causes of suicide amongst adults aged 28 to 49 in England, yeah?
Yeah, in England. Yeah, that's it. Yeah, although I'm concerned that England is just too big, but that's fine. You can try, because you can narrow afterwards. If the data can be broken down into small local area, like maybe east of England, maybe center of England, or east of England, or down even to the boroughs, if you can, then that will be fine. Because here there's southeast, east, you see, those are much bigger. Yeah.
But I don't honestly, I couldn't find specific relevant data.
The question is, where are you looking for it? You should ask your teacher. You should ask your lecturer. Try to say, okay, I'm stuck here. Eh?
She's rubbish. I showed her my work today. This woman is fed up. Honestly, she's a fed up lady. She's tired.
So why can't she retire and go home?
She's very old as well. You know what? Everyone in class said even today, I did the presentation. I knew within my heart, this presentation is not good. And she goes, yeah, okay, well done. I hope you're all right. Yeah, okay. I said, Jesus Christ Almighty.
Oh God. Okay. All right. Okay. Now, which sites have you been to?
So I've got loads of I even found this research. Let me forward it to you, yeah?
Yeah, but which sites did you go to? Which websites have you been?
Let me go on my website. Let me show you. Oh, So I went to go to my favorites. So I went to I got the National Suicide Prevention Strategy Work Plan, New Policy and Evidence on Suicide Prevention, NHS Long-Term Plan, WHO, National WHO National Suicide Prevention Strategy, and then new data reveals suicide prevalence in England as well. Suicide prevention and medical breakthrough. So a lot of the things I found on Google Scholar, and then there's a woman, right? Let me show you this woman. She really sent me very good work. It's like a research that I couldn't access, and then she sent it to me, and I was like, oh my God. 1 second. I got suicide risk and protective factors as well. All journals, what I'm reading out.
But you didn't tell me what journal is that? Is that the name of the journal that you're talking about?
Yeah.
Yeah, but those journals, so they seem to be more not UK ones. So what you need? I thought
No,
you have got.
it's UK.
I thought you have got the mental health associations within here.
Yeah. Let me send you this link. 1 minute. Yeah.
So they don't have the statistics there.
I got a Samaritan's report. Let me send the details. 1 minute. Yeah. They did this big research. Yeah. It's like in 3 different categories. Like 1 second. Let me just go all the way back. Page 1. Men, suicide, and society. Why disadvantaged men in why disadvantaged men in midlife die by suicide. And then so they got the content is gender relationship breakdown and suicide risk, men suicide in society, economic perspective, male suicide in midlife, linking private troubles and large social processes, and exploring the role of masculinity in suicidal behavior. And this woman is in Belgium, and I wanted to access it, and she sent it to me. I said, "Oh, thank you."
Right. Okay.
So I've got very good research, like as in resources. I just need to.
But are they relevant? That's the question. They are very relevant. So
yeah, to the scores it is.
Okay, so here we are. Suicide and self-harm are not mental health problems themselves, but they are linked with mental health distress. In 2017, 5,821 suicides were recorded in Great Britain. Of these, 75% were male and 25% were female. Okay, so the question is, why is suicide more common among male than in female? Then between 2003 and 2013, 18,220 people with mental health problems took their own life in the UK. So this is the statistics you need, and this is on mental health, statistics.
Where? Which website?
This is let me just copy it and send it to you. Yeah, this is more relevant because you can see there it's broken down, and the most common cause of death for men aged 20 to 49 years in England and Wales. Okay, so they say suicide is so you can see even the differences between England and Wales. One person in 15 had made a suicide attempt at some point in their life. So you can see if one person in 15, okay, if we can know the causes, then we'll be able to prevent people progressing from this attempt to go to actual suicide. Then the suicide rate in England rose by 8% between 2015 and 2016, with 728 suicides registered in Scotland in 2016. And there are actually more statistics here. So this is much more relevant because we are dealing with London, England.
Yeah.
I don't think you can really finding a data is a problem with the is finding the relevant data, which might be
an issue.
Yeah. Let me send it to the link. Okay, so there's the link. Try to see if you can find something there. Just open it.
Send it via email.
Yes. So open it and see what is there.
Okay. Yeah, I'm on the website now.
Mm-hmm.
I'm going to download the PDF. That's actually really good.
Yeah, and that's the information you need. And also, when you can look there, so they are starting from 20 years to 49. So follow that, because you have evidence that you'll be able to find the information for men aged 20 to 49 years. So you can try to see what are actually our common causes. So suicide is the most common cause of death. But what you want is, why do people want to commit suicide in the first place of that age group?
Mm.
Yeah, because if you find the reasons, then you'll be able to develop a public health program that will prevent them committing suicide.
Yeah.
Yeah.
And that's my assignment, basically.
Yeah. Okay.
So why do individuals want to commit suicide? Find out the causes, and then when I find out the causes, I can implement.
You can use it to develop the program, public health prevention program.
Prevent public health. What did you say again? Sorry, I couldn't hear you.
You are going to use it to develop. You need to develop public health programs. That is going to help you to prevent suicide.
Right, thank you.
Yeah, because if you don't know what is causing them, there's nothing that you're going to do. Okay?
Yeah.
Okay?
So
and you can see there are also further references down there. So follow those references and then try to find the things that you're looking for. This is not, I don't think it's an issue which you should worry about in terms of data. But if you take data that is relevant, then it's not going to make sense to everybody. Yeah.
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 Perfect. Should I just do? I'll just keep it as that, isn't it? Because the causes are technically the detriments and the inequalities.
No, that's not the way we do research. No. Inequality itself, okay, it's a broader term. There's inequality of resources, inequality of distribution of income, inequality of so many different things. Yeah, inequality in terms of jobs. Now, if you go with already causes in your head, it's going to be difficult for you to find.
No,
now, what you're doing, you are working as if you're blind.
No, because the assignment keeps talking about inequality.
Yeah, but inequality is, you are not going to attach that. That's what you want to try to find. Inequality of what?
Yeah.
Inequality just means the differences. That's all. For the fact that I can't access the services, does not necessarily mean I'm going to commit suicide. No, that's not true.
So if I get the cause, if I understand the causes, I can understand the inequality that they're facing in health.
No, if one of it is going to be inequality, now we need to be specific. Is it because they can't access the services? Do you think you're going to commit suicide because you can't access the services? What you are trying to say, probably programs are not there available to people so that they can make them understand, be educated, be understanding that the problems they are facing, okay, some other people, they are facing the same problems. What they need is to know what's the solution. The solution is not to commit suicide. Because as I told you right now, okay, what happens is if you are having problems in the marriage, or your marriage is broken down, is that the end of the world?
No.
No. Should you really take your life? Now, to you and me, we will see it as completely abnormal for people, even you can call them madness. That obviously because of these problems, then they're going to commit suicide. Because you think life is too precious. You see, but them, when they're in that particular situation, they do not know where to turn to. You see? And they don't even see other people. Like as I said, in my country, for example, you will never see someone outside mourning and complaining. Even among women themselves, they suffer in silence because they have been told you don't talk about the bedroom problems to outside the people or even in the sitting room. Therefore, you're going to suffer in silence. The only thing you will see that by the time you reach them is too much. If they haven't run mad, which means even running mad might be a savior for them because they are going to be taken to the hospital. But if they haven't run mad, the next thing is just you hear that they have committed suicide. What happened? They were seeing as if they are happy couple. You know, we saw them working together, laughing together. No, because the life they show outside is not the life they show inside the bedroom. Because that's the cultural problem. Now, for you to discover all this, it means you need to interview people. You're going to find different causes of why people commit suicide. Okay?
Yeah.
Yeah, and out of that information itself, that's the wow. Now you say, okay, so what sort of program can we develop that we're going to prevent to do this? We need to educate the people. Okay?
Yeah.
Yeah.
Okay.
But if you just focus on inequality is totally vague. You don't even, what are you talking about? Inequality of what? Okay? Because there's inequality in terms of jobs, the inequality, as you can see, women, okay, less paid compared to men. That's inequality of pay. Okay? Can someone go and commit suicide? The answer is no.
I know.
Even inequality of where we live. Okay?
I know.
Yeah. Yeah, so try to make sense of what you're talking about. Okay, there might be inequality in terms of maybe the way they access the healthcare services, but definitely that is not going to cause people to commit suicide. But what you are trying to say is that they have no access to maybe the public health services that are there, which means community things like community projects, community programs where you go around talking to the community, try to understand what their problems are. Okay?
Yeah.
Yeah.
Okay.
Mm.
But am I allowed to talk about like there's loads of cuts that have happened that've caused a rise in suicide as well, or not?
What to cause? Sorry.
So there's
like what?
cuts, so there's a lot of budget cuts that happen that's close these services. So do I touch upon that as well or not?
If you find evidence to support you, yes, because that is more to do similar to what I was saying.
Yeah.
If you are helpless, you don't know what to do. Okay, the worst is to have children. Okay, I will tell you, for example. Okay, myself in 2011. All right, I lost my job as a result of this government cuts because one of the programs I was running a training program as a training consultant for one of the charity organizations for the whole of United Kingdom. And the total budget of my whole program was actually coming from a Ministry of Health. Okay. Now, as this government came into power, they cut that money completely. Now, obviously, charity could not manage to raise money to continue paying my salary, despite the fact they wanted the training program to continue. Okay. Then what did they do? So immediately the first they did is to cut my hours so that I should work only 2 days a week. Then afterwards, they realized that even if I had to work 2 days a week, they couldn't afford to pay me. So what did they do? In the end, they decided they're going to terminate my job. Now, terminating my job at that time was very painful because my last born was at actually university. I had just gone in the first year of university. You can imagine. It was not easy. You see? Yeah, it was not easy. But now the way I took it, I said, well, these are the problems. I had problems before. And therefore, I came out of it, and they are not going to last forever. You see? So what did I do? All I was worrying about is my daughter, not me. No. Okay? But now, because I've come from where obviously we have been exposed to these difficulties, where obviously we are from a poor background. Now, we don't just do things to think of ourselves. We do things to think of other people. Now, I have to think of my mom is alive, my dad is alive. Now, even if I commit suicide, is that going to help my daughter? The answer is no. You see? Yeah? The answer is no. So what did I do? Okay. I even told my director, I said, oh, don't worry, I'm getting the job. Are you sure? I said, yeah. And my director was really very concerned because he thought I was going to break down. Literally, he didn't want me to do that because he knew my daughter has just gone to university. Now, I said, look, a year before, I said to my daughter, I'm going to buy this car. Okay, despite the fact that this car is expensive, but in case of trouble, you can sell the car and use the money to go to university. You see? So he said, Dad, but you're going to spend a lot of money. I said, yeah, I'm not thinking of now. I'm thinking of future and I'm thinking of you. Okay? So then I told her, I said, look, this is what has happened. So he said, what are you going to sell the car? Why should I just not take a year out? I said, no. If you were a boy, I would have accepted it. But because you're a girl, I will not accept it. Okay, because the opportunity is now. If you miss this opportunity now, you start moving around, you take a gap year out. Gap year is not for Africa, it's not a problem for them. But you are not used to this. By the time you come back, if you're going to be pregnant, what I'm going to do? You have even increased problems for me. You see? You have no job, you can't do anything. The only thing we need to do is find a part-time job I'm going to continue looking for work. And it took just 2 weeks, and then I got the job. Okay, I got a part-time job. Then after 1 month, then I went to university to start lecturing at university. And then I told my daughter, I said, oh, look how things have worked. So that just continue, no problem at all. He says, but you have incurred a lot of debt. I said, no, that's nothing to do with you. It's me. You see, but you can see even that sense that you have to kill yourself will depend on your ethnic background, where you are coming from. For me, I didn't see that as a reason to commit suicide. You follow? Yet I had no access to public funds. By then I had no indefinite leave to remain, which means whatever problems I had were problems of my own. Do you follow? Yet I have paid a lot of taxes. I've contributed so much, NI, whatever. You see? But the thinking of leaving my daughter, leaving my mom, leaving my dad, even the time I said my job is gone, I remember talking to my mom. I remember talking about that. And my mom reminding me, you are my father. Because see, my father died when you was young. I look to you now. I've grown young now. I'm no longer independent. I'm depending on you. So whatever decisions you make sure that you know that you're going to protect us. So you can see the differences there. Now, why? Because we are so much attached to our own parents. We are so much attached to our own relatives. Okay? When you are totally isolated, you don't attach to anybody, you can see how difficult it is. I mean, how easy it is for you to commit suicide. Themselves. So if you find the evidence, then that's fine. You can use it. But now, what can you do with the cards? Do you want to criticize the government?
No, I just think that as a suggestion or as a prevention, it's to have more funds available.
We are going to get funds. The government says we need to cut it down. The borrowing.
But with this research and with the backup, I'm sure I can ask for recommendation to
do what?
to help.
You are not doing politics. No.
No.
So
how do I ask as a nurse?
Well, there's nothing you can do as a nurse. Look, it's the government. It's the government. That's what exactly I'm telling you.
Okay.
Should I get across? The answer is no. Did I feel bad about the government? The answer that time was no, because I didn't understand why they wanted to cut down. And then, they wanted to cut down the borrowing, because also too much borrowing is going to affect people. You see, if the government borrows a lot of money, all right, as it was, you can see our taxes are going to increase. What is going to happen to us then? Immediately, your disposable income is going to be reduced. You're going to mourn again.
Yeah.
It will even be worse off if your disposable income drops down and you're working so much. You need to see the link there. If you are doing politics, yes, because you can criticize government policy, but that's not what your job is. Your job is to look at the public health. Things that they are related to public health, not to politics. No. Yes, you can, in passing, you can say, yes, people obviously, because of government cuts, okay, they had nothing involved, maybe let's say income, whatever. You can explain that, you can talk about that, but that is not going to be the main cause of it. What you need to do, you are trying to do, how can we develop evidence-based public health intervention program? Because that's what your program is about. That are evidence-based. But definitely the government cuts is not going to help you to do anything at all. All you need to do is try to look at it, how can people, okay, be resilient, so you train them to be resilient in difficult times. And then you are saying, for example, during the government cuts, when the people have lost their jobs, they have no income. But where can they turn to? Okay? But if you say, no, they need to make money available, no, that doesn't work that way. Because you are telling the government to borrow more money. If they borrow more money, it's you who's going to suffer. You see? Because the taxes are going to go up so that the government can collect the taxes and pay back the loan that they have borrowed from IMF or World Bank or whatever. You see?
Yeah. I'm going to do that. Okay, perfect. Yeah. So we've changed this crazy assignment again. Now I'm on the path of I'm going to get this started and finished. And
but definitely, make sure that you understand, because at the end of the day, you want to say, okay, how can we develop a public health program that are going to prevent people committing suicide? The only way we can do that is to find what is causing that. Once we find the causes, then we are going to deal with those causes so that people do not progress to committing suicide. Okay?
Yes, perfect.
Yeah.
Thank you so much, my friend. When can I book another appointment for effective practitioner?
You just need to check because this is exam time. So until second week or third week, I think second week of June, that's when things become easy. So what you need to do is always just check.
This assignment is the deadline is for 11th of June.
Right. So as I say, whenever you need help, you just actually send me a message a day in advance and see whether I can fit you in. The things will be easy in the second week because by then some have actually finished some of the papers, so it becomes a little bit easier. But at the moment, the demand is just too much, and I've even cancelled some of the other students.
Oh my God.
Yeah.
Okay. Thank you. Yeah.
All right. Okay.
Bye. Thank you. Bye bye.
Okay. Bye.